One blood test, one number. For millions of men, that number quietly triggers fear, uncertainty, and life-changing decisions.
It starts as a routine checkup. Then 3 letters on the report suddenly take center stage. PSA.
An hour ago, he felt perfectly fine. Now his mind is racing because a number can feel like a verdict.
The questions arrive fast. Is this cancer? Do I need a biopsy? Should I be worried right now?
This moment is more common than people think, and it happens to men from every background.
PSA testing touches presidents and CEOs, but also everyday fathers and grandfathers.
Modern medicine has learned something important over decades of screening. PSA alone doesn't tell the whole story.
PSA is prostate-specific, not cancer-specific. It can signal prostate activity without explaining the cause.
When PSA is treated like a yes or no cancer test, it can lead to unnecessary biopsies, anxiety, and avoidable harm. For years, PSA above 4 was treated as danger, and lower numbers felt automatically safe. Large studies later showed that this black and white approach was deeply flawed.
In fact, most men with PSA between 4 and 10 do not have prostate cancer.
And some aggressive cancers can appear even when PSA is below 4. One big reason is benign prostate enlargement, which becomes extremely common as men get older. PSA can rise from enlargement, inflammation, or other benign factors, so context matters more than the raw number.
So today, the better question isn't, is PSA high?
Okay. Yeah.
It's, why is PSA high in this person?
Right.
That's where PSA Density and PSA Velocity come in, 2 tools that interpret risk in very different ways. PSA Density adjusts PSA for prostate size, PSA divided by prostate volume. PSA density is calculated by dividing PSA by prostate size, a simple equation with powerful implications.
A larger prostate has more PSA-producing tissue, so the same PSA number can mean very different things. Think of it like output per size. Proportion matters more than the headline number. As men age, benign prostatic hyperplasia, BPH, becomes increasingly common. By age 60, more than half of men have some prostate enlargement. By age 80, the majority of men are affected. BPH can raise PSA through more glandular tissue, more leakage into blood, and chronic low-grade inflammation. Without adjusting for size, PSA low can overestimate cancer risk, especially in older men.
PSA Density corrects that distortion and helps female Caucasian doctors interpret PSA in a more biologically realistic way.
Clinically, a PSA density below about 0.15 is often associated with lower risk of significant prostate cancer.
Above that level, concern rises. Not certainty, but a stronger reason to look closer.
To calculate PSA density, doctors need prostate volume, often measured by ultrasound or MRI.
MRI has become a game changer because it measures volume precisely and adds visual risk information.
MRI can reveal whether suspicious lesions exist, helping separate likely benign causes from higher risk findings.
When PSA density is low and MRI is negative, the risk of clinically significant cancer becomes very small. In many cases, that combination allows doctors to safely avoid biopsy.
This is how many modern screening pathways work, using multiple signals before choosing invasive testing.
The benefit is real. Fewer unnecessary biopsies, fewer complications, and less psychological stress.
The goal is not to find every tiny cancer. It's to find cancers that truly matter for health and longevity.
Better interpretation protects quality of life because fear and overtreatment can be damaging too.
For patients, PSA density turns confusion into clear questions you can bring to your doctor. Instead of obsessing over one number, you look at size, density, imaging, and long-term trend. This proportional, context-driven approach reflects routine practice at many major medical centers today.
PSA density isn't perfect. Volume measurements can vary, especially between ultrasound and MRI.
In places without easy imaging access, PSA density may be harder to use consistently.
But when imaging is available, density becomes a powerful filter that reduces false alarms. The big idea is simple. Context matters more than panic.
Now let's talk about PSA velocity, the measurement of how quickly PSA changes over time. PSA velocity focuses on speed, how much PSA changes per year across multiple tests. For example, PSA rising from 2 to 3.5 over 2 years is about 0.75 per year.
Years ago, velocity became popular because fast rises were linked to higher risk cancers in early studies.
Later, larger analyses showed the problem. PSA has a lot of natural noise. Even healthy men can see PSA fluctuate from test to test without anything dangerous happening.
Temporary inflammation or infection can cause short-term PSA spikes that mimic a worrisome velocity.
Lab differences and timing differences can also change results, creating false alarms.
That's why velocity is rarely used alone today. It's a signal to double-check, not a diagnosis.
Velocity remains useful during active surveillance, where long-term trends help detect meaningful change.
It's also helpful over 5 to 10 years, where the long view reduces the impact of random spikes.
When PSA jumps unexpectedly, doctors look for explanations, repeat testing, and often reassess density and imaging. Think of it this way. Velocity grabs attention, while density helps guide decisions.
Population data generally shows density is more specific, while velocity can create more false positives.
Real decisions come from combining multiple clues: PSA, density, trend, MRI findings, and personal risk factors.
It's like cholesterol. One value matters, but the overall risk picture matters more.
The most practical takeaway is to ask better questions, not to panic over one lab value.
What is my prostate size? What is my PSA density? What is my long-term trend? And what does imaging show?
When patients understand these concepts, conversations become calmer and decisions become more thoughtful.
The prostate is about the size of a walnut, yet it can hijack dinner conversations and Google searches.
Understanding brings back peace of mind, because uncertainty is often the real source of fear.
Long-term trends matter more than short-term swings, so tracking over time can be more informative than reacting to one result.
Bring your past PSA results to appointments so your doctor can see the true pattern, not just a single snapshot.
When doctors see the pattern over years, they can separate normal biology from a truly concerning change.
Bottom line, PSA density often guides our decisions, while PSA velocity supports awareness and prompts a closer look.
This video from Nourish Today is for education and general information only, not personalized medical advice.
If you have abnormal PSA results or concerns, speak with your physician or a qualified urology specialist for guidance specific to you.
At Nourish Today, we focus on calm, evidence-based health information without panic, hype, or fear-driven messaging. If this helped you feel clearer and more in control, subscribe to Nourish Today for more science-based health explanations.
Because life is too short to let a lab number steal your peace of mind, when context can restore balance.